Your arms ain't long enough. Your arms ain't long enough to box with God. You know what I mean? Ford ain't having it. So he ejects Roman Barber. Is it Bar? No, it's Babber, right?
I don't know if it's Baber or Baber. That's
I
the
think it's
problem, but I
Baber.
would
I think
say
it's
Baber.
Baber. He says the lockdown isn't working. It's causing an avalanche of suicides, overdoses, bankruptcies, divorces, and it's taken an immense toll on our children, Baber wrote. Dozens of leading doctors implore you end the lockdowns. Baber also noted spikes in overdose and eating disorders and delays in cancer screenings and job losses. The number of COVID 19 patients in ICU amount to less than 1% of each of the province's 492 hospitals, so the crisis could be better managed by transferring patients, he said. Baber also said COVID is real, but the fear of COVID is exaggerating. While every death is tragic, after 10 months, we've learned that COVID is not nearly as deadly as first thought. It has a 99.98% infection survival rate, he said. I am the first to recognize that COVID 19 has had a devastating impact on people, Ford said. However, as Premier, my number one priority is the health and safety of all Ontarians.
Ford's reaction speaks volumes. The more important part is that there's numbers, there's data to back up what he's saying. There's numbers that show that majority of the people that are being sick or that are passing away from this are above a certain age, or they're living in certain conditions, which is group living circumstances, such as the long-term healthcare facilities, which is majority of the people. There have been 0 children who have died from this, but schools are not being allowed to be opened when kids aren't really showing that they're passing away from these things. He states in one other part the capacity of the ICUs in our hospitals, and states that right now there are about 300 and something patients currently who would require ICU because of COVID, but we have over 400 hospitals. So that's less than one ICU patient per hospital. So why are we broadcasting that these hospitals are overwhelmed with COVID patients? People are actually getting sicker mentally. Mental health is deteriorating. People have been out of work. Jobs, businesses are going out. Ford sees this as somebody who has the information, like the government does.
Yeah, he came with some numbers. Yes, he said some doctors said this and this, that, and the third. You have to remember what Ford said, and I'll just keep it as simple as this. Ford said, my job is to protect all Ontarians. Dre, you said most of the people who are dying are from long-term homes.
Mm-hmm.
People are out there acting like these aren't people too. So what, we should just toss them to the side? He said his job is to protect everyone. And like I said, like, you can't make everyone happy. You can't be a part of the government and go out there and put out a different narrative, especially when you're on the same team as, you know what I mean? If you're on the opposing team, I get it, but you're on the same team. That's crazy. You have to go at that point.
Right, but then see, you got to look at something like that too. This is a guy who's on. You saying that he's part of the squad makes it even worse. Makes you even look at it even worse now, because you think that somebody on the squad having the same information as everybody else would be for this. To the long-term healthcare people, obviously, those people are people too. I'm not saying don't have concern for them. Obviously, you should have care for all of the people. But when you state a fact like there have been 0 children who have died from COVID, 0 children, and you have certain things like schools that you have decided are not essential. Think about the things that are essential and not essential right now. The things that are essential are things like McDonald's and Walmarts and Lowe's and fast food places and those type of things. Think about the things that are not essential right now. Schools are not essential. Gyms are not essential. They've closed down playgrounds in certain areas. Kids can't go outside to play. They got to be inside and figure out something to play, right? They are making decisions to me, and this guy is only backing up my questioning of this. They're making decisions to me that are saying to me this is not about a disease. Everything that's going on right now has nothing to do with this disease and these vaccines.
I have a daughter. I have no problem going to parks. I'm outside with her when I get the chance. I play in front of cops. Nothing. So I don't know anything about that. Every single person thinks they can do the job better. but it's not your job. Just because this guy is, a part of, Ford's government, that doesn't mean that he won't have his own opinion on it. I'm sure Ford's closest ally has their own opinion on how he could do things differently. But all they could do is advise him. And if he chooses not to take that advice, that's his decision. He's the premier. That's his job. What this guy did was irresponsible, if you want to know, if you want my opinion. Because at the end of the day, the public can feel however they want to feel about it. They could think Ford is an idiot. They could think he's stupid. Why are you doing this? This is a conspiracy. This is a that. That's fine. But then when you have somebody from the government doing that,
it only backs up those people's
no,
thoughts.
that is not. That's very irresponsible.
Yeah, I could hear what you're saying on that.
Very
irresponsible. For some people that could be because not everybody's really all the way together, and there's some people that kind of get carried away with this type of stuff. So I could see what you're saying on that.
He could have all the points in the world. You can have, and everything he could be saying could be 100% accurate, but that's just not how you go about it. Anyways, let me know what you guys think, man. Should this guy have gotten fired the way he got fired? Should he have went public with the information? Do you think he could have approached it differently? Leave it in the comments. Don't forget to like and subscribe. Keeping it moving. All right, you guys, we put out new videos every single morning at 10 a.m.
Yes, make sure you like and subscribe. Check out these videos right here and subscribe right down here. We're trying to get to at least 100 followers. We're not far, man. Subscribe.